welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I'm going to talk about a very interesting topic, that is sleep. Now, we all love to sleep, isn't it? I'm sure that if given a chance, any of us would want to sleep off during our leisure time. But to give you a little bit of bitter facts about sleep, globally, it is estimated that over 936 million people, they suffer from sleep apnea, with 28 million being in India alone. So recently, regarding this sleep issues, a survey that was conducted across different countries, which actually looked at attitudes, perceptions, behaviors all around sleep health, as well as its impact on an overall well-being. Now, the survey that I'm talking about also found that the majority of the respondents surveyed during this protocol recognized the importance of actually achieving a quality sleep. So to talk to us in detail about this particular sleep-related issues, we have with us on board today Dr. Sibasish Dey. He is the head of medical affairs, South Asia and ResMed, who will actually be giving us valuable insights on how sleep health can actually shape the well-being of the Indian population. So to talk a little bit about our speaker today, Dr. Sibasish Dey is currently the head of medical affairs in ResMed India and South Asia. He takes pride in his mission to actually spread awareness and address the unmet in sleep disordered breathing, along with optimizing the management of COPD patients needing non-invasive ventilation support. He has extensively been involved in therapy education and research focused on perioperative critical care therapy, ranging from anesthesiology, fluid management, nutrition, and CRRT over the past 8 years. Dr. Dey has overseen and led successful product launches and high-impact therapy platforms on balanced fluids, parenteral nutrition, and blood purification devices. In his previous assignment, he was associated with Baxter as Medical Affairs Manager, Southeast Asia, based out of Kuala Lumpur, Malaysia, responsible for nutrition, anesthesiology, and CRT. And he is, to talk about in detail, he's an avid traveler and learner. So I welcome you to Medical Dialogue, sir. It's actually a pleasure to have you on board here with us today.
Thank you, Dr. Nandita Mohan, for for bringing us here, giving us this platform, and I would like to extend my thanks on behalf of ResMed also, because today is World Sleep Day, and it's really exciting to speak on sleep. I think that's one area which we typically ignore. And because, I always say that we sleep over our sleep, right? So I think it's exciting. And at the same time, I would like to spread more awareness around sleep and sleep apnea. Thanks for having us here.
That's great, sir. So, sir, if you could just, if I could just talk about this, as we are highlighting the World Sleep Day and the World Sleep Month being March. As per the survey that was recently conducted by ResMed, it was found that around 58% of the Indians, they consider snoring as a good sign of good sleep, rather than the problem of obstructive sleep apnea. So what actually is your say in it?
Yeah, I think, Dr. Nandita, it's not a big deal. I mean, we were expecting that amount of numbers because, be it culturally, we always say that, and I looked into my families and my friends also, that, look, if someone is, snoring, it is typically recognized as, that individual is sleeping very well. It's like gore bech ke so raha hai wo banda.
Exactly.
Right? So I think the numbers are not astonishing for us, but I think the numbers are on the higher side. 58% is quite a big number. But I think over the period of years, particularly ResMed and the medical fraternity, which is associated with sleep, has spread a lot of awareness around sleep apnea, because sleep apnea globally is quite big. There is close to 1 billion patients across the globe. And this data is from Lancet 2019, right? It's like at least 3 or 4 year old data which we have. And the other bit is, almost 85% of these individuals are not getting diagnosed. Just 15% of these individuals are getting diagnosed. So yes, the numbers are there to speak for itself.
That's actually true, sir. 58%, as you mentioned, is really a huge amount. So if I talk about the survey in detail, it also highlights that about 97% encountered a barrier while seeking treatment for sleep issues. So if I could just talk about these barriers, what do you think would these be?
Yeah, I think the barriers are there. And, we, even before this survey, I think we were, kind of aware. I think this survey has put certain amount of numbers to it. So first of all, most of the individuals not know where to get started with this therapy. And what we could see from this survey is that, almost 32% of the individuals could not understand, okay, how do I get started, whom to reach out for, the treatment of sleep apnea. And then even if they reach out, there is another percent, similar number like 32%, they say that, okay, I don't know what could be the potential results of if I get this treatment. And then similar percentage said that, okay, even if I take this treatment, is it too costly for me? And, is it going to improve my overall health, right? So, between 32 to 30% of all these individuals, they had all these issues. I mean, those were the barriers, right? And of course, one of the biggest barrier is the stigma or perception that, okay, I have to take this device every night while I'm sleeping. What will the other individuals in my family think of? So, right from understanding that, okay, whom to reach out, whether this treatment would be effective or not, even if it is effective, can I bear the cost of the treatment, right? And then, of course, the stigma associated with it. So I think these were the barriers which we recognized during the survey.
So majorly, sir, if I could just highlight, I think from the points that you've just mentioned, the two main important factors will be, one will be, I think, the financial constraint, which I think is a really big concern among Indians. And the other one, which is the stigma that you highlighted. Obviously,
Yeah.
I think there are not many people who are actually even aware about this. So using the device itself becomes a huge challenge for such people.
Yeah, and I think the number one point is also very important, that whom should I reach out to? Because in our country, we don't have a designated course of a sleep specialist, right?
That is true.
So
Yes.
it's the pulmonologist who practice sleep, and there are fellowships and certifications which are happening currently. So the larger population is also unaware whom to reach out to. Okay.
Very true, sir. So, sir, the survey, again, to dig in a little bit deeper into it, it also showed that, as we mentioned, there is some hesitation among the Indian population to actually seek treatment for sleep apnea or other sleep conditions. So, we discussed few factors. Is there any other possible factors that is adding on to the financial constraint or the stigma that you just mentioned?
I feel, it's more of, what we have seen in the market and among the patient community is that, okay, if someone undergoes a sleep test, or maybe a preliminary OSS screening, there is always a hesitance to accept the fact that, okay, can sleep lead to so much of detrimental issues in my life, because when we talk about sleep apnea, it has association with type 2 diabetes,
Yes.
stroke, depression, heart failure. So it is very, very hard to digest, actually, that can sleep lead to all these issues, right? And then they search over the internet, reading about the issue. They reach out to their friends and family that, do you have this kind of issue, and what have you done about it? And probably one of the things, if they are good with some general physician, they would kind of approach and, kind of know or try to learn about it more. So I think people or patients want to take, steps bit by bit before going into the actual treatment and getting diagnosed and so on. So I think this is a long flow. These are also the barriers.
Right? So firstly, I will definitely agree that Google Baba I think people just go into that portal nowadays. Everything is just a click away. So everybody has smartphones. Everybody just can Google it immediately as to whatever the symptoms they feel. They just immediately Google, rather than just approaching a doctor who can actually guide you about what the problem you are facing genuinely.
Yes, yes. And so, I mean, we were recognizing this issue. So what we did in ResMed is that, let's put up some blogs onto our website,
Mm-hmm.
right? Around sleep health, around OSA, how the treatment would look like, and so on and so forth, just to spread, some soft awareness before they actually get into the therapy piece.
That's very good. That's very good, sir. So, sir, again, coming to the next question that I have framed, what is your role in the development of these new digital health technologies that are basically used for the detection and the treatment of sleep disorders?
Yeah. So, let me give you a perspective of what ResMed is doing or
Mm-hmm.
has done currently over the last several years. So, right now we have close to 19.5 million cloud connected devices. Okay.
Okay.
And we have around 13.5 billion nights of clinical sleep and respiratory data, right? And almost
Okay.
7% of our revenue goes into active research within ResMed.
Mm-hmm.
So when we see these throughputs, we see a lot of things coming up. So one of the things which we wanted to address is that suppose a patient has to take a diagnostic test, can we simplify it, right? So we developed a disposable test called the one sleep test, right?
Mm-hmm.
And so this is a disposable test the patient can take back home,
Okay.
use it for 3 nights, and at the end of fourth or fifth night, they get the I would say the sleep report over their email.
Mm-hmm.
The other issue which we realize is that suppose the patient has taken the therapy, right? So now what happens? They need some amount of hand holding, and the clinicians need to follow up the patients. So there are
True.
softwares like AView where the clinician can actually look into the data, how the patient is breathing, how much the usage of device is happening. And
Mm-hmm.
at the same time, we also have a patient-centric app called the MyAir app, where the patient can actually see how good they are doing, right? So,
Oh.
so I think we have tried to address these issues through digitalization mainly, right? So I think these are the innovations which are happening currently, and
Mm-hmm.
all these three softwares or programs which I just mentioned are available across the globe, also in India.
Oh, that's really good. That's a very good protocol that actually ResMed is following. So, as you mentioned, these digital health technologies or these three new techniques that have come up, how do you think the millennials or the Gen Z or the Gen X are actually responding to the use of these digital technologies?
Yeah, yeah. So I think well, if you see uh, right now, the major working population are the millennials, and they
True.
would be the major working population at least for the next 7 to 10 years. Even I am a millennial, right? So what we could find from the survey is that almost 47% are using some amount of sleep tracker to actually record their sleep habits, either through some wearables or something else. And it is more a bit higher on the side of millennials. Like you would find 54% of the millennials doing so. Whereas
Mm-hmm.
if you look at Gen Z, it is around 44%. With Gen X, it is around 40% of them are using some kind of sleep tracker. But I think what I would like to point out is that people are aware, somewhere that, they need to track how they are sleeping.
Mm-hmm.
But what we always say is that, it's good to track your sleep. But if you want to get diagnosed, use a proper medical device like what I mentioned, the one sleep test, something like that. So that you are doubly sure of what's happening to you and what's happening to your sleep.
That's very true. Great. That is great, sir. So, any other valuable insight that you would want to give our viewers that you would want to spread awareness on? You can always let us know.
Yeah. So, I always say that, uh, sleep is like, we spend close to one third of our life, right? So please be very aware how you are sleeping. And over and over, I think if you go to any sleep conference, any sleep symposia, you would probably hear about, healthy sleeping habits or sleep hygiene techniques. So I would say that, please follow the sleep hygiene techniques. Try to go to bed at the same time at night, get up on the same time, form a routine. Dim your lights 1 to 2 hours before you are sleeping. Shut down all the gadgets, because gadgets have played a havoc even when we look into our survey. And people have explicitly told that, I take my gadget to bed, right?
That is true.
So at least 1 hour before sleep, don't interact with any gadget, right? And if you're having, kind of difficulty in sleeping, listen to some calm music, take a warm bath. Those things some people can do. Also, no caffeine at least 3 or 4 hours before you are going to sleep. So I think these are small things people can follow to get a good night's sleep. I have followed few of those myself. I was heavily into gadgets during the pandemic time, so I also decreased my gadgets. At least I don't interact them while I'm in my bed, right? So these are the things which I would tell everyone.
So that's great. So I think that is just one point that everybody can take into, because with this tech savvy world that we've entered now, everyone has a highly performing gadget, a phone specifically, and they all take that to bed, through their bed sometimes. So definitely that point will, I am pretty sure, if that difference, if they take into account that, keeping their gadget away from their before going to bed, that itself will help them a lot in improving their sleep quality.
Absolutely. Yeah.
So thank you so much, sir. Thank you for your valuable time. And it was great having you on board here with us. It was lovely to be interacting with you today.
Thank you. It's always a pleasure, and happy to be a part of this interaction with Medical Dialogues. Thank you so much.
Thank you so much, sir.
Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.